switching over to the coronavirus, hospitals in Florida and other states are being inundated with coronavirus patients. In Texas, hospitalizations have more than doubled in the last 2 weeks. And Arizona hospitals are at an 89% capacity. And in Florida, in the last 2 weeks, hospitalizations are up 40%. So far in July, the U.S. has recorded more than 300,000 new coronavirus infections, bringing the country's total inching towards 3 million. And since February, we've officially surpassed 130,000 deaths nationwide. As Laura Podesta reports, the nation's top infectious diseases expert, Dr. Anthony Fauci, sounded another note of alarm.
West Virginia is the latest state to require face coverings when in public.
I know in my heart that if we don't, we're going to have funeral after funeral after funeral.
Some people around the country still refuse to wear them.
You are further pushing the agenda that is condemning all of us.
Actor Tom Hanks, who had COVID-19 in March, said he doesn't buy the argument against masks.
I simply do not get it. It is literally the least you can do.
Meanwhile, hospitalizations are rising at a dangerous rate in places like South Florida.
Our hospitalizations are at its highest level with 1219.
Miami-Dade County is shutting gyms and other businesses back down to try to slow the spread.
But healthy individuals and small businesses, we also have to live our lives and we have to pay our bills to feed our families.
In southern Arizona, hospitals are struggling to provide ICU beds.
The only way to get a new patient in the ICU is if somebody dies, which is happening, we see, or somebody gets discharged or downgraded.
Dr. Anthony Fauci says the rise in cases is a serious situation.
We are still knee-deep in the first wave of this.
The California State Assembly is delaying its return after some members tested positive.
Heartbreaking feeling that you will feel when you know you have affected somebody and put their life in jeopardy will destroy you.
Atlanta Mayor Keisha Lance Bottoms says she's tested positive for COVID-19. Laura Podesta, CBS News.
So for more on this, we want to bring in Dr. Dyan Hes. Doctor, you're a pediatrician. Not only does the president want to see this, Florida announced that they expect schools to be open next month. So clearly, states are pushing forward, at least some states are pushing forward with this. If it's going to happen, what do parents, teachers, students need to do and know if they find themselves back in a classroom come August or September?
Well, what's interesting is that I'm on all these chats with other physicians, and I just read about a school district in Ohio that's not even mandating that the teachers wear masks. So I feel like the left hand doesn't know what the right hand is doing. I think if your child could tolerate wearing a mask, you should really have them go to school with a mask. I think if your children are very little and can't wear a mask the whole day, like the 2-year-olds, 3-year-olds, that the teachers, the minimum that we ask is that the teachers wear masks. We know that it's more the teachers are the shedders than the students giving it to the teachers. It's vice versa. So I really think that you should send your child to school with Clorox wipes or wet ones and teach them how they can clean their desk. I think when your kids come home from school, you should have them undress at the door and wash all their clothes and, as best as you can. Leave your shoes outside if you can. I mean, we're even talking about washable backpacks. Maybe we should wash backpacks every day because we don't know, if it's droplets and they're landing on the backpacks that are all in the same closet, maybe your backpack should be cleaned. Frequent hand washing, sending your child to school with hand sanitizer as well. I mean, we don't, I always say that the little kids, they start, when they learn to wash their hands in school, sometimes they wash them so much that they get irritated and eczema. So checking your kid's skin to make sure that there's no cracks from washing so frequently and moisturizing well, maybe putting Vaseline on their hands at night. And then if your child is sick, remotely sick, you have to keep them home. You cannot send them to school. Everything can be a symptom of COVID: diarrhea, cough, stomachache, headache. So if you remotely think your child is ill, you should really contact your healthcare provider.
And I think what's so sort of scary about the coronavirus is I feel like every week we talk to you and there's sort of new information that we're learning about the virus. And a part of that has to do with information about the airborne particles that now they may be able to travel further than we previously thought, at least when people are inside.
Exactly. So that's why I was talking about your backpack. So if somebody talks and spits and it lands on your backpack or it lands on your clothing, although I do believe that we've known it's been in droplets the whole time, I think that it just needs more testing. I was actually not surprised by that study that came out, because I think that the cruise ship, that even 17 days after the passengers were all off that cruise ship that was infected with COVID, like where almost all the passengers had it, they were able to culture COVID off the walls 17 days after everybody was off that ship. So it's not surprising. And that's why we recommend the minimum of 6 feet of social distancing.
Wow, that's scary stuff. So when you were listing off the possible symptoms, that you should watch in your child, you listed off a bunch of different things, not just a cough, like people associate with COVID-19. And I was just recently reading a bunch of articles that talked about doctors noticing damage to small blood vessels in COVID-positive patients, and them thinking that might be part of the reason why we're seeing COVID-19 symptoms in such a wide array, that anywhere where these small blood vessels may be, any organs could be impacted. And we're seeing neurological issues in children. Can you talk a little bit about that?
Yeah, that's rare. So the neurological article, the article that was published in JAMA, it's rare, but in those children who had extreme MIS-C, the multi-inflammatory syndrome in children, in some of those children, there are 4 case reports of children who had neurological sequelae. So they either had slowing on an EEG or changes in an MRI in the corpus callosum. This is not surprising, because this is what this syndrome does. It affects all of the blood vessels. So it's not sparing the brain, it's not sparing the kidneys, it's not sparing the heart. We're going to just need to follow this with more data. And remember, these kids usually are not acutely infected with COVID. This is a post-inflammatory reaction. So it's very hard to prevent, because most of these parents didn't even know that their children had COVID. So you just have to be very aware of it. And that's why I say, like, if your child has a headache, that could be a symptom of COVID.
And we've talked a lot about the sort of secondary impacts of COVID-19. We've got a new study out taking a look at new moms and how they're struggling and how this pandemic has exacerbated their situation. I remember when I was a new mom and I would go to the pediatrician, she would not only check out my daughter, but she would ask me questions about myself. How am I feeling? Am I in a safe environment? All those sort of things. And we've talked a lot about how when you're not seeing a doctor on a regular basis, there's additional information that doctors don't have access to that, could save lives. Can we talk about how this is making it even tougher for new moms? And being a new mom is pretty tough as it is.
Yeah. So we have families that are completely socially isolated, especially in New York City, because a lot of people move there for work and that's not where they grew up. So now you have a new mom, sometimes a dad, not always a dad, or sometimes a new dad and not a mom. And they do not have the parents there for support because of their age or the risk factors. They do not have the baby nurse that they thought they were going to have, or a doula, or a friend, even a friend, and they're alone with their babies. I cannot tell you how many telemedicine calls I do for new mothers, because it is overwhelming. It might not even be that the child is ill. Most 99% of the time, the child is fine. It's just that the parents are staring at their baby, they're alone in their home, and they think everything is going wrong because they have nobody to support them. And the isolation, people are afraid to take walks. I try to encourage them, put your baby in a stroller, take a walk at 7 in the morning when the streets aren't crowded, go out in the evening when it's dusk and the streets aren't crowded. And they are terrified of COVID. We give an Edinburgh postpartum depression scale to every parent, every mother, newborn mother, and they have been going off the charts. And I've referred a lot of parents to postpartum therapists or groups. There's even groups online that support other new mothers, and they can talk to other mothers who are experiencing the same things that they are.
And as we've found over and over again with the coronavirus, some groups are impacted in a way that is greater than others. And when we're talking about this topic, African-American moms are impacted or I should say that they are disproportionately affected. Do you understand that?
Yes, and they even before COVID, African-American mothers were disproportionately affected by postpartum depression. So now everything goes up. All the numbers go up. The lack of resources, the insurance. Can you pay privately for a postpartum therapist? Do you have access to telehealth to speak to somebody? So some studies are showing that this is one silver lining, is that telehealth has improved and parents have more access. But you have to be savvy to gain that access. You have to have good health insurance who's going to pay for that. that access. So there are a lot of mothers out there, especially in lower income sectors, who do not have access to all of those perks of telemedicine or a therapist. Most insurance companies don't pay for therapists.
Well, we are truly grateful that we have access to you on a regular basis. Thanks so much for bringing us up to speed, Dr. Hes.
All right. Thank you. Have a good day. Be safe.